Hello, everyone. Today I'm going to give you a short presentation about Russian healthcare compared to United States healthcare. First, I would like to give you a little background information on Russia. Russia, otherwise known as the Russian Federation, is a developing country, as opposed to the US, which is a developed or industrialized country. The Russian Federation is made up of 83 federal subjects. It is the largest country in the world. It was also previously known as the Soviet Union, and the Soviet Union fell in 1991. However, many health problems from the Soviet Union, such as health, human welfare, and mortality crisis, still occur. One of the first comparisons I would like to make are health outcomes between Russia and the United States. In Russia, the life expectancy is about 66.46, so let's round down to 66 years of age, and that is 72 years for women and 60 years for men. I also wanted to state that 15% of the population is under 15 years old, while 18% of the population is over 60 years old. Now, in the United States, the life expectancy is 80.7, and we can round that one up to 81 years old. And the average is 76.1 years old for men and 81.1 years for females. The male to female ratio in Russia is 46.3% male and 53.7% female, while in the United States, the ratio is 49.5% male and 50.5% female. One of the major health issues in Russia is the male mortality problem. So as you noticed on the previous slide, males have a lower life expectancy than females. We see a very high male mortality rate in the age range of 15 to 64, and even more specifically in the age range of 40 to 60 years of age. Now, there could be many reasons for this, but some hypothesized are due to high tuberculosis prevalence, and it's about 115 cases per 100,000, which is much higher than the rest of Europe. And Russia also suffers from very high HIV rates as well. Another important part of the healthcare system you should take note of is the cost of the system. In Russia, health expenditures are very low. It's usually 3.6% of the GDP compared to the 6% of their European counterparts. And the United States actually spends more on healthcare compared to any other country at 16.9% of the GDP. Russia is also funded by private healthcare funding. Russia also has a higher percentage of private healthcare funding, 39% compared to the 24% in Europe. And they're funded both privately and through the government for their health insurance. Let's also place some emphasis on the quality of healthcare in Russia and in the United States. Russia is very focused on specialist care as opposed to primary care. Mostly in urban areas, so rural areas suffer. For instance, out of 124 private specialized hospitals in Russia, only 4 are located rurally. Rural areas have small healthcare centers, so they often lack specialty care. They may only include a feldsher, or that would be the United States equivalent of a nurse practitioner or a physician's assistant. And on average, there is 49 doctors per 100,000 people in the population. However, in rural areas, there is only 12.1 doctors available. In the United States, the US may spend the most money on healthcare. However, it still lacks in certain areas. For instance, we still see poor health outcomes, low life expectancy in some areas of the country, high suicide rates, high chronic disease burden, and high incidence in obesity. Now I would like to take a second to look at the overall healthcare systems in both of these countries. In Russia, similar to the times of the Soviet Union, the Semashko model is still used. This is a multi-level system covering specialty care facilities and hospitals among different regions, both rural and urban. However, issues include that there's too much emphasis on specialty care, as stated previously. There are undervalued and poorly trained physicians, and lack of attention for communicable diseases. In the United States, the healthcare system is considered to be highly fragmented and decentralized, and local clinics and hospitals really lack the collaboration that is needed for a successful system. While the insurance specifics for both these countries differ severely, what they have in common is both countries have had to try to have reform in the aspect of insurance. For instance, Russia passed Article 41, or the Mandatory Medical Insurance Program, and this guarantees every citizen free healthcare. Also, later on, the Guaranteed Package Program was passed, which is a plan to cover basic medical services. However, these plans often lack competition and incentives for physicians and choice of doctors for the citizens. So often private insurance is supplemented. However, in the United States, there are different assistance programs while there is not free healthcare for everyone. Medicare, for instance, is an insurance program, and it's specifically for those 65 and older or young disabled people. And this program is paid into over the years. Medicaid is an assistance program as well, and this serves low-income people. And more recently, the Affordable Care Act was passed, and this was designed to make healthcare more affordable for everyone. Not quite universal healthcare, but maybe a step in that direction. Lastly, I wanted to touch briefly on the differences in training for the doctors and nurses in both these countries. So in the United States, you should be more familiar with the training for doctors and nurses. So doctors, let's say on average, train for about 12 to 18 years. However, in Russia, nurses study for 4 years, while general practitioners study for 2 years and include some specialty training. And we see a lot more of these general practitioners. As I mentioned before, they're also known as feldshers. And this is similar to what you're going to see in the rural areas where they really don't have a lot of access to specialty care. I hope these differences provided some oversight for you. Here's a slide of my references. Thank you.